Hidradenitis suppurativa, or HS, is finally getting some much-needed attention thanks to increased awareness and resources focusing on diagnosis, treatment, and support for patients. There are now 3 FDA-approved therapies for HS, but a new survey of 500 HS patients found that 3/4 are unaware of these treatments, and 56% said that their healthcare provider had not discussed these options with them. In this episode of Beyond the Headlines, study author Dr. Adam Friedman, professor and chair of dermatology at the George Washington University School of Medicine and Health Sciences in Washington, D.C., chats with Brindley Brooks, the founder and executive director of HS Connect, about the new findings and how to close this gap and get HS patients the care they deserve.
So some of the key results we generated, and even in some sense were surprised by, from a study of over 500 individuals with hidradenitis suppurativa, an incredible cohort that we could only access through a wonderful collaboration with HS Connect, were as follows. First and foremost, over 75% of those surveyed were not aware of FDA-approved treatments, or that there even were FDA-approved treatments for hidradenitis suppurativa. Of those who did know, 50% plus actually did not know because a dermatologist or doctor told them about that. Even more concerning, 18% of respondents were satisfied with their regimen. That is unacceptable. That is more than data. That is a call to action. Now, I don't want to be all doom and gloom, because actually the purpose of this survey was to really get a sense of the impact of an FDA approval for a drug indicated for hidradenitis suppurativa. And the good news is over 70% of respondents said that it gave them hope that more was coming, that it did inspire confidence in the medical gargantuan industry, so to speak. So while certainly there were some significant gaps in education, in communication between the practitioner and the patient, as well as with what is actually being given to these patients, there's also a glimmer of hope that now with 3 FDA-approved options and hopefully many more on the way, that will really improve not just the quality of the condition for these individuals, but also will improve quality of life and every facet of psychosocial well-being that those not suffering with HS and being undertreated probably have to deal with every day, but we take certainly for granted. So to really give more flavor and color to these just simply data points, I am joined by my good friend, my HS powerhouse superhero, fill in the blank, every Marvel character you can imagine, Brindley Brooks, who is the founder and head of HS Connect. Brindley, with the data I mentioned, is this a surprise to you? Or you're like, yeah, of course, that's what was reported based on your experience and of course your experience with HS Connect.
I was personally shocked by how many people did not know about FDA-approved treatments. I think it kind of gave me a little bit of a reality check, because being an advocate, I'm, on the front lines. I know what's happening in the HS world, and it's very commonplace for me. But it really reminded me of how many people are not connected to any kind of patient advocacy group or in the know about what's happening with all of these approvals that are coming and all of the drugs that we have in the pipeline.
The FDA has approved adalimumab, secukinumab, Cosentyx, and bimekizumab to treat moderate to severe HS. In addition to these biologic medications, there is a robust pipeline of emerging HS therapies.
Okay, so how do we spread this information and do right by all of our patient community, not just those who are on social media or who are currently checked in with HS Connect? So I think it's one of the things we need to obviously do better at, and have a better pulse on the community in so many different ways.
To your point, 3 out of every 4 individuals who responded were not aware. And I never thought about it from that perspective as someone who's running a patient advocacy, a patient-facing organization. That is alarming, but also inspiring in that there's obviously a lot of work to be done to really improve that. And I think the good news is that knowledge is actually therapeutic, that those respondents shared that knowing that this is happening, and I've seen this in other disease states too, that when you have a name for something that has been unnamed, when there's actually a ICD-10 code, I can actually bill you for an actual condition, it's not just in your head, that is validating. But also if there's a medication that was designed and studied for you, meant for you, not, and I love off-label, I'm not hating on off-label, but it's not off-label, it is meant for this condition, it's purposeful. I think that there is an incredible emotional and then by default physical impact. So I think while it's startling, it also suggests that if we get that word out there, it's going to have a really benefit impact.
I completely agree. And that part is really, really positive and uplifting to know that 75% of those people's lives could be different and better as a result of just knowing that these drugs exist. And that is something I think the HS community really needs, because there has not been a ton of positivity. You know, the disease in general is not, it's not fantastic. It's not, would not recommend. I'd give it 0 stars out of 5. But at the same time, yeah, if I could give negative stars, I would. But at the same time, I think that the piece of hope and positivity that this study also provides is absolutely amazing. Now we just have to figure out how we continue to educate patients about drugs that are FDA approved. And I think even not even just approved, but how deep the pipeline runs right now for other HS drugs. I think there's so much incredible work that's being done in this space that the majority of the people aren't even aware of. And I do think that it would provide so much hope to the people who aren't aware, but that answered this survey in the way that they did, knowing that that hope is just sitting there waiting to come through as soon as they're given a piece of good news about this. So that part does really excite me and makes me feel like, I already feel like the HS community is catching on fire in a really positive and good way, not negatively. But that passion and that hope is going to come through even more brightly. And that we can totally change people's lives just by introducing them to the fact that these medications are available, and then helping them work through how to talk to their physicians about them, how to get prior authorization templates through the HS Foundation, you know, how to help lay the groundwork for their physicians if they haven't brought up the medications. How do you address that as a patient with your physician, that I'm interested in doing this because of the quality of life that I'm living with right now and the potential quality of life that I could have. So I don't know. I mean, from your perspective as a physician, I was kind of shocked to see the numbers that only 50% or even less had actually heard about any of these drugs from their physicians. So we know there's a huge gap there. We know there's a huge gap in educating patients about what's going on too. So what do you think about marrying that together?
Yeah, no, it's a struggle, and some of the other kind of non-targeted but really purposeful and useful data points that came up when we just getting a sense of who these patients were they were serving. We're still seeing the same 7 to 10 year delay in diagnosis from onset of disease, and these are patients who have more advanced disease. And to give the community credit, the majority knew their early stage, which is kind of an outdated and antiquated staging system, more of a surgical staging system.
Even in 2025, HS patients continue to face diagnostic delays, often misdiagnosed as other conditions, and a lack of awareness among healthcare providers.
Because it doesn't appear as frequently as it does when you're, later on in stages, which is also part of the problem with treating HS, because we're trying to get in and treat HS at an earlier phase, but we can't do that because it's not being identified properly until stage 2 and above. And they'll commonly say as a physician, like, well, you're not bad enough yet. I thought the whole point was to prevent getting bad enough to where you've now done tissue damage and it's irreversible. But unfortunately, that isn't kind of the way that it's going. And I think, to your point, a lot of that has to do with patients seeking care at emergency rooms or urgent care, because they're not asking that one really important question about chronicity. And it's an untapped place that we need to do some more education. And if anyone has any ideas, please hit me up. Because there's a lot of gaps of where we need to identify to help patients get diagnosed. And definitely that's one of them, is the urgent care and the ER. I think we're missing a lot of that with referrals to derms because they're not asking the question about chronicity.
I think an appropriate and very meaningful step would simply just be having those individuals ask themselves, could this be HS? If we just had people saying, could this be HS? Then it's not a laser focused, I see a quote unquote boil, me need to cut open and drain and pack and then go on to the next patient. If you see it and you take a moment like, could this be HS versus a true infectious process? Then you may say, hey, has this happened before? Brindley brings up such a good point that we would love to catch all these patients in the early stages to be able to prevent progression. And there definitely are probably many ways we can do that from a theoretical standpoint. We haven't had the chance to do it. But if you simply ask those questions, because you're not going to see the signs of chronicity, you have to ask, because early on, maybe there's a little dyschromia, some discoloration, maybe some remnant of something. But if you're laser focused on that giant painful nodule, you're going to miss the forest from the trees. So what I would love to see is germs included, but also non-germs, just like scratching and said, could this be HS? Let me dive a little bit deeper. And Brindley, to your point, I think there are ways to integrate that type of questioning into workflows in ERs. That is something that, just to maybe foreshadow a little bit, no one steal my idea because no one else is listening to this. Yeah, is to work with eMed and to maybe incorporate that into the kind of abscess protocol, just to kind of ask a question or two to see maybe is there something else going on. I think that alone would make a big difference. So now people are thinking about it and they're talking about it.
Yeah, absolutely. I think that it's got to start somewhere, and we've been developing ways for it to start. And I mean, single-handedly, I'm asking every single ER physician or urgent care physician that I come in contact with, but that's a really slow roll. So
I think you at HS Connect are doing a great job. Clearly a very engaged community, in terms of getting 500 responses on a survey is very difficult. I can tell you from a lot of experience, you really have to sweeten the pot, so to speak. But I think from speaking as a physician, as a residency program director, training residents, and even working with medical students, I think you have to fix the leaky pipeline on HS education early on. And I think this study was a great example of that. The real workhorses of this study were amazing medical students, Angelasia Murdoch, Cleo Whitting, Sarah Azim Abdel, and many others, at GW. I feel like getting students engaged in this type of research is also a way of educating them, not through a textbook, not through a didactic, but they're actually seeing firsthand, especially when you're talking about patient-related data and patient-based surveys. They're really getting a taste of how impactful this disease is in terms of the open-ended questions and answers, but even from the data itself. But I agree. I feel like there's been such a long period of time where HS patients, even if they had that title, that disease name attached to what they're experiencing, they didn't really know where to go. And I think this is a general trend in dermatology overall, is that when there isn't a lot to do from an on-label perspective, when there aren't drugs, when there isn't industry interest, it's a hard pill to swallow. It's hard to get people to join the committee. But when there are drugs coming out or already out, when industry is investing, now everyone wants to be part of the cool group, right? And I think that it's phenomenal that that does serve as a magnet to kind of welcome in more individuals who may feel okay about managing it, but they need to learn more. Now they're willing to, but also they're willing to be very visible in that they can take care of these patients too. I mean, an amazing stat I learned when secukinumab received the indication for hidradenitis suppurativa, there was a 13% bump up in the utilization of biologics. It's been hard to make a dent. Obviously psoriasis was a kind of poster child for these types of drugs. Now we're seeing them for atopic dermatitis, HS, and probably we'll see more coming, for chronic spontaneous urticaria. It has been an interesting history in that very often there's a very slow uptick in terms of willing to incorporate this into your regimen if you've never done it before. But to have that sudden surge in a matter of months with an indication tells me with more medications comes more comfort in utilizing medications to manage this really complicated and often difficult to treat disease. So many reasons why we need investment, as well as time and effort into getting these over the finish line to the shelves so that our patients can actually have options for their management.
yeah, I think, part of that is that I call them like our HS lifers. Most of us at some point have heard from a dermatologist that there's nothing more they can do
Yep.
to treat our condition. And I think that becomes part of a way of life at a certain point, and there's not much hope that's given after that point. And to that, I think that the education that comes out of these kinds of medications, the unbranded campaigns, the branded campaigns, all of this that help to raise more awareness. I know for me personally, that was something that drew me back in after I had been told there was nothing more that could be done for me, was that I saw an ad and was like, okay, maybe the landscape has changed. So I know that that can be a really, really powerful thing that we as a community need to see ourselves reflected, and know that there is additional things available for us. That kind of sparks that hope, especially for people who aren't tuned into a community. So I really do hope that in the future we'll be able to to see more of that come to light too, and that patients can see themselves. I know, just a giveaway, HS Connect is doing a huge national campaign starting, I believe it's going to launch in October, called Find Us. And that is our goal, is to have people identify themselves in the skin of other people with HS. My wife looks like that. My husband looks like that. Oh my God, that looks like my skin. And then to find their way to HS Connect, and then eventually find their way to treatment, to good dermatologists. So that's really what we're looking forward to, and trying to manage that, from a patient advocacy perspective, and then also really wanting to be good partners to the medical field, to the people who treat us, to the people who don't yet treat us, but what if they knew us? Because we are worth it. But it is also important to understand from a physician perspective, I think, that we're not your sprint. We're not your, remove some basal cell carcinoma off of a body part and then you send us on our way and you see us 1 year for our annual check. We are your marathon patients. We need you to run by our side, hand us water, deal with when we have ups and downs, and help to figure out how to help us. But we are so worth it. So, and I'm sure you know that, because you work with us and you're one of the best. So
Thanks for listening to this episode of Beyond the Headlines. Make sure to listen to part 2 when Dr. Friedman and Brindley Brooks play a game called What Never to Say to an HS Patient.